Ready to go?
You guys are live.
Great. Good evening. This is Beth Hallett, Nantucket Public Schools Superintendent. Welcome to the September 28th, 2020 Public Forum to answer questions as to school reopening with Nantucket Cottage Hospital, the Department of Public Health, and school officials. Permit me to confirm that all panelists are present and can hear me. I will call your name, just answer in the affirmative, please. Zona Butler.
Here.
Tim Lepre.
Here.
Jennifer Iller.
Present.
Steve Sordovic.
Present.
Jennifer Erickson.
Present.
Pauline Proch.
Present.
Michael Horton.
Here.
Diane O'Neill. Malcolm McNabb.
Here.
Sarah Brooks.
Here.
Diane Pearl.
Here.
Paige Martineau.
Here.
Dawn Holgate.
Here.
Eve Marie McNeil.
Here.
Alice Crowley.
Here.
Roberto Santamaria.
Here.
Gary Shaw.
Here.
Martin Angelov.
Here.
Logan O'Connor.
Here.
Kimberly Kubich.
Here.
Mandy Bassel.
Here.
Have I missed anyone? Michelle Epps.
Present, thank you.
Thank you. And now I'm going to turn over the meeting to Pauline Proch, Chair of the Nantucket School Committee.
Good evening, everyone, and welcome. This public forum is being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, we have been advised and directed by the Commonwealth to suspend public gatherings, and as such, the governor's order suspends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed and encouraged to participate remotely. Ensuring public access does not ensure public participation unless participation is required by law. This public forum will feature public comment. Please note that this meeting is being recorded and that all panelists are participating by video conference. Accordingly, please be aware that other folks may be able to see you and to please take care not to screen share your computer. Anything that you broadcast may be captured by the recording. I'm just going to review some public participation guidelines for you. We are using Zoom webinar for the meeting, which allows for the public to participate in the meeting as an attendee. Attendees must register to participate. The registration link is unique to this meeting. The registration link can be found in the description of the Nantucket Government TV YouTube live feed for the meeting. People registering must be an attendee and they must use their full names, otherwise they will not be allowed to participate in any discussion. Attendees will join in listening mode, and when you have a comment or you have a question, you can please click the raise hand button that will appear on your screen. If you move your mouse, you will see the raise hand button. And if you wish to make a comment or ask a question, please raise your hand. And our moderator, Jennifer Erickson, will call on you. She will take questions in order that they come in. The YouTube chat will no longer be enabled. Again, the only way to make a comment or a question is signing in through Zoom. All questions should be directed through the meeting moderator, Jennifer Erickson, and please, when you are not speaking, mute your phone or computer so that we do not hear and have any extra background noise. Please, when you are speaking, remember to speak slowly. That's good. Slowly and clearly, not like I just did. Okay, thank you very much. I'd like to pass it back to Dr. Hallett. Thank you.
Thank you, Madam Chair. I wanted to, first of all, thank everyone for coming this evening. I know it was quite a last minute pulling together of a public forum, but we wanted to give an opportunity for everyone in the community to have a chance to be heard and to ask questions and to participate in discussion. Also with some of our health experts here, we have Dr. Diane Pearl, Chief Medical Officer, Gary Shaw, CEO of Nantucket Cottage Hospital, Roberto Santamaria from Department of Public Health, Dr. Malcolm McNabb, Board of Health. And we certainly want to and appreciate them being available to help us answer some questions around a very challenging decision that needs to be made about returning to school in the hybrid model based on where we are, particularly with our COVID-19 cases. So I'd like to begin by asking if questions at this point would like to be begun. I think we have a pretty large group, so I'm happy to turn it over to our moderator to start some of our questions, if that's okay.
Shall I share the questions from the public comment email for the town? I'm not seeing anyone else. I don't know if anybody else is.
Start with the town, the emails that you have.
Okay. Lisbeth Carol Fuller says, are you considering outdoor learning spaces / field studies, and will windows be opened or closed?
So we will be happy to bring students out into outdoor learning spaces as appropriate. Of course, we have to look at weather, and we have to look also at accessibility with regard to what type of learning is happening. If there's online learning happening during a class, it's difficult to be outside. We understand that that it is a chance for students to have some outdoor time, and certainly some classes might warrant outdoor activity, such as phys ed. Some of our other specialist classes might offer the opportunity to be outside. Certainly windows can be open if it allows for the weather allows for windows to be open. That's absolutely can happen. And clearly, I hope that answers the questions to start.
Next question from Kate Garrett. Actually, it's 4 questions. The first one, other districts in Massachusetts and other states are seeing success with allowing the younger children to go back to school first, those children who otherwise can't be alone. Kindergarten to 3 or kindergarten to 5th. Why is that not even a consideration on Nantucket?
In thinking carefully about equity and thinking also about how we would like to bring students in, we considered all different possible models, and the agreed upon model was a hybrid learning for all pre-K through 12. It allowed for as much opportunity for students to have some equal time in the classroom. We do have our cohorts, which also allow for specific opportunities for people to be in the classroom longer or less, depending on choices that parents have made. We understand that having the littlest ones in is very important, and it is our hope that they are the group that we can focus on as we move forward and potentially out of a hybrid model if health metrics allow it.
Second question from Kate Garrett. In addition, can NES and NIS consider using the gym, library, art rooms, other media rooms as classrooms so more children can attend?
Yes, we have considered all of the above and have considered how that would work. It is challenging, and if possible, I would like to allow Mrs. McNeil to answer in particular if she'd like to, because we are talking about, or also Mrs. Kubish, because both of them, the question was raised for these schools. We do need to make sure that the learning environment is conducive, and we are using some of that space as our as additional classroom space as well. So Mrs. Kubish or Mrs. McNeil, if either of you would like to add to that.
Sure, I'll go. I'm having some trouble with my connection being stable, so let me know if I freeze. We definitely considered those spaces for classrooms, and we're holding them, if you will, because we have booked up our other classrooms like as solidly as we can with students. And in the event more children were to move into town and we need to accommodate them, we have, say, the art room available or the music room available that can hold just a little bit more. The gym wouldn't really be conducive to holding large classes. It's very echoey, it's loud, and we've reserved it as an alternate space where classes can go and spread out and do some movement activities, or potentially two classes could be in the space at the same time, not necessarily intermingling, but engaging in some movement type activities. So we want to have those options available to us too, especially as we consider the winter weather coming and the challenge with getting outdoors. Our cafeteria is also reserved as a learning space should the need arise for us to evacuate a classroom so it can be immediately cleaned and sanitized. We know that we can go to another place. We have to have another place to go. So for those reasons, we're not using every single space available at this time.
And I would just add that our spaces are being used the same as Eve Marie just shared, and our cafeteria will also be used potentially for the extended day through the community school. We have a limited number of teachers on our budget, and we've gone beyond what we intentionally thought we would be hiring this year to accommodate for students who are learning in the remote setting. So the spaces that we have adults in all of them. Our teacher may be Zooming from her classroom to another classroom. Our gym is currently being used for storage of all the furniture that we needed to remove from classrooms to allow for more students to be in. Just back to the other question, I would say that we also have all pre-K kids welcomed to be in cohort A. We have had some families select cohort D. The same can be said for kindergarten. The majority of our students are able to come in, and our teachers wished to have that. And then there are those who have self-selected B, C, and D.
I do see the two raised hands. I'm going to finish the email questions from Kate Garrett first. If the town of Nantucket stays open with adults able to drink and eat indoors, attend church gatherings, all without masks, what is the long-term plan for the public school children? Unfortunately, COVID is not going anywhere. The spikes will continue all winter if the town has no limitations on adult activities. My concern is that they'll never have the chance to start if we keep canceling before even trying. Let's push this topic more for the children. They deserve more, and the systems are failing them right now. That's question 3.
So I understand and hear the concern that this parent has. I understand where we're coming from. I'm certainly happy to say that we really do want to bring our students back and give them a chance to try for a safe return to hybrid learning. I will, with regard to what is happening, particularly in the town of Nantucket, with the regulations for restaurants, for public gatherings, et cetera, I might turn this over to Roberto Santamaria or Don Holgate or anyone else who might want to comment on this if possible.
Absolutely. So what we're really running into is that there is no science right now to link any of the cases to the restaurants. Right now, this current surge is due to an expected failure. You know, the masks aren't 100% positive at all at blocking all the virus at all the times. We're going to see some breakthrough, and that is that's what we're seeing across the world, actually. Right now, we're following every one of the governor's orders, and right now, those orders have been working. There is no cases associated with restaurants, bars right now, or any of the other types of social gatherings, including the theater and TV, not TV, Dreamland, the movie theaters. So that's really kind of where we are there. We don't want to make decisions based on the perception of risk. We need to have empirical evidence of the risk, which is unbiased, pure, unadulterated data. So as of right now, there is no plan on restricting these businesses or trades more than the governor order has already done.
Anyone else want to comment on this from our panel? Don, go ahead.
I think that over the last few months, we've all kind of learned the tools of how to function in this new world of COVID. And I think we're at the point where the only sort of part of our daily life that hasn't come back to some form of a new normal is where the children are involved in their school life. And the data from other states so far and Roberto has a better handle on this than I do, but I've been looking at some articles, is not really showing significant spikes related to children returning to school. And I think that we just need to keep watching all of these pieces. And if we need to put some restrictions in place, we will, but it really has to be very driven by necessity. And although we have more cases, there's more testing happening, and there fortunately are not people who are very ill, they're recovering. I hope that's helpful.
Okay, Kate's last question from Kate Garrett. How can we as a town do more for the less fortunate children of our town? Is anyone checking in on how they're doing? Perhaps a survey to see how remote learning is going for the masses. This should be proactive before it's too late. There have been more suicides on Nantucket versus COVID deaths since January. Where is the uproar for mental health concerns?
So I certainly know that our teachers and our principals and our counselors and social workers within the schools are keeping good track of what is happening at school with the students who are perhaps higher risk. I know this is a challenge within a remote environment, but I also give kudos to our teachers and our educators who are trying very hard to keep tabs on some of the children who may be at higher risk and having a harder time with remote learning. Deborah Gately, our new special services director, has shared with us that remote learning is challenging for her for special needs students and students who really do need that day-to-day, face-to-face interaction. So that's another reason why we know it is important that we build in and we consider some in-person learning. I don't know if anyone else would like to share anything with regard to this question. I'm certainly happy to turn it over. Roberto.
Yes, so it just so happens that today we got the death information from the town clerk, and there's only been one logged suicide since January of 2020. And unfortunately, we have had one logged overdose as well, overdose death. But to my knowledge, those are the only 2 deaths associated right now. So the idea that more people have died of suicide and drug overdoses since the start of COVID is incorrect. And one of the things historically, absolutely, we've had really rough winters. And coming into this winter, yes, with COVID fatigue and some of the COVID depression that we're seeing across the country, we need to really pay attention to that. That's why we have been working closely. Our Human Services Director, Taylor Hilst, has been working closely to connect with our elder services groups, because that also is a major mental health portion on the island. We've been connecting with Gosnold, Fairwinds, and the hospital to make sure that mental health needs are taken care of on the island here.
Okay, Steve Laredo, would you like to talk?
Sure. Hold on one second, please. I'm wondering if you could tell us anything about the opinions of the faculty as a whole towards reopening this week in particular, and what we know about the way staff are feeling in general. And I'd like to ask a follow-up question after that, please.
I would be happy if either Paige Martineau or Alice Crowley would like to share how faculty have addressed this particularly. Happy to have you speak to this if you're ready.
Sure, I'm happy to take that. Paige Martineau, high school teacher union, teachers union co-president. We did conduct a survey of our membership. We had 198 responses. The survey we conducted on Sunday morning, midday-ish, before the Sunday numbers came out. And the faculty was fairly split down the middle. And our second question asked if numbers kept on coming in, what would people feel? And at that point, we were about 60-40, 60% saying that we needed to delay, 40% saying that they would like to come back in person. I think overall, teachers want to be with their students, but the issue of safety is still an immense concern. And I did not ask for specifics in terms of elementary school, NIS, CPS, NHS, and perhaps I should have drilled down a little bit there, but I have received today dozens of emails, very concerned about the numbers and about the news that, possibly some of the people in that church could be more closely tied to our school community, could be parents of kids who are in our school community. So teachers are nervous. That being said, we hear a lot of the concerns that Kate Garrett was asking in her questions. Remote learning is not easy for teachers either, but we really have to weigh our safety. And I think at this point, seeing those larger case numbers and the 168 tests, I think that are in the queue right now, it's just very deeply concerning. And I think a lot of people are worried about the starting and stopping phenomenon as well. If we open up and then numbers spike even further and having to close down. So at this point, I think probably we're in that phase of the 60% thinking that we need to hold off on opening, but there's certainly faculty members who feel differently than that.
Is there anybody who would like to share or respond or offer anything? Roberto?
Yes. So as far as the cases going on, the spikes, things like that, we were expecting spikes. There are always going to be cases, and some of those cases will be connected to schools. That is the fact of the matter. Some will be parents of students, some will be students, some will be teachers, some will be other staff members. That's going to happen. There was a staff member in the hospital that was found positive. Those types of things are going to happen. It's just part of the reality of COVID. But what we're finding is there is the hybrid learning environment in Massachusetts was actually ranked #1 best and safest school programs in the country right now by the National Educational Association. Those numbers actually came out earlier this morning. So there is an inherent level of risk. There's an inherent level of risk going to the store. There is an inherent level of risk in everything we do. COVID is here to stay, and we need to learn to cope with those risks as we move forward. There are fears, and I absolutely agree with them. I have fear going into work, but I have to go to work because it is my duty. The firefighters, the police officers, the nurses, the doctors, we all have our duty to our community. And I'm not saying you're not doing your duty by going on remote. That is absolutely what you're doing. But there is also a whole segment of the population that doesn't do well with remote learning and requires that in-person connection. Everything from a mental health side, as well as through a pure didactic learning side, especially with some of our special need population. So I feel that coupled with the information that we've received through the National Educational Association, saying that Massachusetts plans have been the best in the country so far, and that since March, when we started collecting data on all of this, there have been less than 100 cases that have been associated, less than 100 spread cases that have been associated with schools in all of Massachusetts. So we absolutely get the fear. We absolutely do. But there is a new COVID normal that we are looking at, and we can't avoid it. And I believe that moving into hybrid is a section of primary intervention that I think is a way to move forward. Like Don was saying earlier, it is the only portion of our lives that still hasn't moved to at least some level of relative normality.
Gary?
Yeah, thank you, Dr. Hallett, and thank you, Roberto, for those words. I guess I would tell those in the community listening that when we started this journey back in March, there were so many unknowns, and over time we've learned more about COVID and how to protect ourselves against it. We've learned that more testing is needed in order to find clusters or asymptomatic cases of it. But where we've traveled in the last 4 months has taken us from limited knowledge to a great understanding of how COVID spreads, what best protects us from it, and how to test for it conclusively so that you have the best opportunity if you come in to be tested of finding something by defining what symptoms look like and how long it takes for COVID to incubate and become a case. When we started testing many months ago, there was great variability in tests that were available, tests that were then deemed credible or not. And we've focused very hard with the Mass General on wanting to have what's recognized nationally and internationally as the gold standard. And so the testing that we do, as we evolved it, we picked a partnership with the Broad Institute and MIT that was supported by the Mass General to be able to consistently get tests done for Nantucket in high volumes if necessary. And our plan was to aggressively focus on where COVID might be. What you have now is an opportunity to test just about whenever. Only limiting factor is weather. And to some degree, that's mitigated that if a person were to come in the hospital and we need to test, we do have the ability to do rapid testing in a limited capacity in the Cottage Hospital. It was never before available until we started really pushing to have that here. But what we are focused on is this testing capability is giving us information in a real time or close to real time, probably anywhere from 12 to 48 hours to let us know where COVID might be. It's interesting in that without testing, we would have cases showing up at the Cottage Hospital. We would be sending those off episodically. We would be asking people to isolate, and we wouldn't be able to clearly understand where this was moving, coming here, leaving here, on the island, and so forth. So through the advance of testing capability, what we've given the island the opportunity to do is know in rapid time where COVID is. And I think that's one of the reasons that you see so many people, when there is a COVID concern, bringing their entire families to the Cottage Hospital and asking if they've met the definition for exposure, which is, being within 15 minutes of a known positive COVID individual. So coming to the Cottage Hospital doesn't always mean testing will happen. It means there's an evaluation, and the clinicians will test as it's deemed necessary by putting those focuses on determination in front of you. But what we want to do is get as much testing done as possible. So I would suggest to this community that having people lined up in the COVID testing line is not a bad thing. It is not something that defines more risk. It defines some comfort in knowing that the community can test, that you can find out if COVID is there. That should be a good thing. We have been fortunate to be able to rapidly test consistently, way more than probably any other community in this state. And so as a result, you have a very modern tool that's very readily available. It gives me a personal comfort level and my medical team that we can look at this community across the board and find COVID if it starts. Roberto had said earlier, it's the new norm. Now that we have testing, we want to find COVID. And so having 0 cases has really never been the goal. Although we achieved that for a few short months, having a few cases, not having spikes that get out of control is really the goal. But I think bouncing between 0 to 10 cases, probably weekly, is something that we'll see as COVID circulates and people become less focused on the protective measures. I call that drift. The Mass Brigham Hospital with Mass General says it's drift. You're drifting, we're drifting as a society away from those things that we know protect us because we're tired of them. And we haven't seen COVID disappear. And we've done all of these things to try to lock down and mitigate. But it does require constant diligence. I won't repeat them. You know what they are. I'm sure you could recite them from your heart. But if we do those things, we separate, we have good quantifiable testing, we actually do have a safe community. And these clusters can be identified and brought under control very quickly. So I would suggest that the data that we have follows the state's recommendation for a safe workplace. It gives us the opportunity to follow the precautions that Dr. Hallett and her team have spent many months on trying to figure out how best to navigate things and start with different levels. Start with different levels of applications to see what effectiveness they have on the community. This hospital's ready for that. The school system's ready for that. And I would suggest that that is an opportunity to do those things for the children that I'm hearing on those questions, to move it forward and still do it in the safest environment possible, in an environment where COVID's not yet gone.
Thank you.
Steve, did you have another question? Steve Laredo? Oh, I'm sorry. Alice Crowley?
Hello.
Can
I jump in? Sorry, I couldn't find the hand button.
Go ahead, Alice.
Okay, thank you. I just wanted to follow up because early in the meeting, Roberto said masks are not 100%. And then just recently talked about the need to return to normal, just as he's going to work. But many of our town offices are not back to 100%. They're not open fully. This particular meeting, I will point out, is being held virtually. Everything coming out that I've read from the hospital and the town is emphasizing smaller groups. So as teachers, we're going to be in a room with 15, I've heard up to 18 in some rooms, students for a day, 45 to 60 minutes, or all day long with this group of people. I think that makes teachers unique. If I go to the market, I'm around a lot of people, but not for a significant amount of time. Even if I were to go to the town building, to the RMV, I'm not there for a significant amount of time. So it concerns me with these spikes going on, masks not being 100%. We're trying to aim for 6 feet of separation, but with children, that's not always possible either. That it is extremely risky. And the last thing I want is a student or a colleague to be sick.
You know, Beth, I'd like to pick that up if I can.
Sure, thank you.
So I would answer it this way. If you look at, many months ago, I came to the town board and the select board and said that we at the Cottage Hospital believe we're ready to address this COVID potential that had not yet shown up. And we were looking at the data on masks, and we were looking at the data on social distancing. If you compare what you're talking about of a group of 18 to what a hospital worker deals with of hundreds of people coming in per day, when you're masked, you hand wash and you distance, it works. Hospitals have typically seen low levels of COVID transmission despite the hundreds of thousands of cases across the country of people coming into the places for treatment. So the protective measures work. And we're doing it in many greater numbers than what the school is being asked to consider. It does work. Masks they've never been touted to be 100% effective, but if a person is wearing a mask, a student's wearing a mask, or let's say a teacher and a student, the risks are so substantially small of spreading COVID when you're masked and you're washing hands that it encourages me and it makes me look at the numbers we're seeing in the community in our Cottage Hospital, and it substantiates what the data is telling us, that it's really a great prevention at this time and space.
I would also like to throw a little bit on that one too. We think of a mask as just like a seatbelt. You wear your seatbelt to stay safe. You're driving down the road, you're always wearing your seatbelt. But in car accidents, because of the severity of some car accidents, people still die regardless of whether they're wearing a seatbelt. People still get hurt regardless of whether they're wearing a seatbelt. If you're wearing a reflective vest while you're out running, people can still get hurt even if they are wearing a reflective vest. The strap on a surfboard was made so that people can have a flotation device if they get stranded out to sea, yet surfers still drown. These are all public health interventions that have had huge reductions in the loss of life. But the primary portion of that intervention is that it's a reduction. People can still get sick. It's no matter what. But like Gary said, coupled with both people wearing masks and distancing between everyone, you can bring that risk level down to a negligible amount. As long as the rules are paid attention to, you can bring that risk to a really low amount. And then the comparison of the town building interaction and interactions out in public and in the restaurants and things like that, it's a completely different type of interaction. It's actually an apples and oranges comparison. So there are specific rules, regulations, and authority that comes inside a classroom that a professor, teacher, administrator has that when you're in Stop and Shop, they don't have. So when you're in a more of a controlled environment, that also lowers the risk. So when you compound the lowering of risks, you get down to a risk level that is, for lack of a better word, acceptable.
Dr. Pearl, would you have any words on that?
I was, yes, thank you. I was nodding in agreement because you do multiply every reduction and end up with the maximum reduction. So the odds that a child in your class has the disease, that's quite low on Nantucket, not vanishingly small, but quite low. The odds that the child has a high enough volume to be spreading it in a large quantity for contagiousness is quite small. The fact that you're wearing a mask mitigates your risk. The fact that the child is wearing a mask mitigates the risk. The fact that they're distancing mitigates the risk. So that when you multiply all of that together, your risk is almost vanishingly small, but not negative, not completely zero. I was on a call this afternoon with Mass General. We were talking about our employee being positive at the hospital. And of course, their response was, well, of course you're going to have a positive employee. Employees live in the community. The community has some COVID in it. It's a pandemic. The entire world has it. But you would expect that. But the potential for that employee to spread it to a patient is negligible. It's almost unheard of. It's so vanishingly low. The potential to pick up this disease from one of our patients is extremely low. So the spread within hospitals is extremely low because of masking. Now, this is before any special kind of masking. This is just a surgical mask on both people, or a mask on both people. And if we follow and we don't drift away from those priorities of safety, then we are able to learn to live with COVID in the world, and that, as we have to do. So I agree that this can be done safely using those measures, but the distancing is important. The definition of exposure, as we probably have heard, is unmasked exposure closer than 6 feet for more than 15 minutes with a patient with COVID-19, one having it and one not having it. You have to be pretty close for quite a long period of time for that transmission to occur. Secondly, the data around living in a home with a COVID positive person, the transmission rate to your household member is somewhere between 10 and 40%. It is not 100%, but I was quite surprised by how low that is if you're going to be in a home, sharing a home with a COVID positive person. So yes, I understand your struggles with this, and we certainly understand your concerns. And I'm not trying to minimize them. It's just that we understand, I think, how to proceed with life in the time of COVID as best we can. Thank you.
Thank you, Dr. Pearl. I know that Sarah Brooks has her hand raised. Go ahead, Sarah.
Hi, thank you. Sarah Brooks. I'm the COVID liaison for the school districts. My question is in regards to the testing. After being on the end of the phone calls and the emails, I guess our Department of Education guidelines are a bit different than what is part of the public health guidelines, in that if anyone with minimal symptoms needs to be tested, student, staff, and I have had people get turned away because they didn't fit the hospital's criteria, which is understandable. But I think we're at a disconnect of all this testing that is said to be going on. But when I'm on the other end of hearing that people have been turned away for travel reasons, which I understand it's an asymptomatic testing. But so I guess my question is, how can we streamline what Department of Education is saying to get tested and what the Board of Health is saying to get tested, and the information is shared with whoever it needs to be shared with so everyone's safe?
I'd like to take that if I could, Sarah.
Sure.
So anybody with symptoms fits the criteria for testing, any of the COVID symptoms. And I have good news tonight that's just hot off the press, actually, that now we've been approved to perform the anterior nasal swabs, which just came through this afternoon. So that is taking a swab from the front of the nose, which is a very simple procedure rather than what we've been using to date, which is an extremely uncomfortable, very deep swab far up into the nose, which children certainly do not like. Adults don't like, children don't like. So now, as of late this week, we'll have the capacity just to test the anterior part of the nose, and that will help us with the kids this winter. But all people with symptoms pass the criteria, meet the criteria for testing. You can't test people if you decide to leave the state and come back. Your insurance company is not going to pay for that. So that is something that you would pay for out of pocket. If you've had a significant exposure, we will absolutely test you for that. But if you've walked past somebody that you know to be COVID positive, that is not really a significant exposure by any medical definition, and then your insurance company won't pay for that. But I do know that there's a lot of discussion when people come through and are turned away, and they're frustrated by that. But I think we can work out some policies with the school that we can enhance the testing capacity or make it at least clear.
That would be wonderful, Dr. Pearl. Thank you. Jen, you're welcome to continue. I don't know if Steve Laredo wanted to finish his follow-up question.
Yeah, Steve Laredo, are you there?
It's not letting me. Here we go.
Oh. I muted him by mistake. My apologies.
Guys, can you hear me now?
Yes, we can.
At the last school committee meeting, we were told that we have leeway as a town in terms of opening while we're in the red code because our population is relatively small. And I know that there's talk about using a larger number for the total town population of like around 17,000 as opposed to around 12. Looking at those numbers, we're the #1 highest rate in the state in terms of cases per 100,000. That was before this recent surge of the weekend. And I believe that there's no other district in the entire state that's opening while coded red. So I'm wondering what makes Nantucket different from all these other districts that are following the state guidelines and staying remote while they're in the red. That's my question.
So I understand where you're coming from. I reached out to Commissioner Riley today and did not receive an answer to speak with him about our situation. The letter that was sent to school committee members on September 14th spoke about the importance of looking very specifically at the test and case data. And understanding specifically, such as we are in a small community, understanding where cases are coming from, how they're clustered, what information we have around cases, and to determine our severity, our risk based on some of that additional information. And the red district and red metric, so to speak, is only one particular metric that should be looked at. There are others that should also be included, and that was expressly clear in that letter. So again, I understand where you're coming from, and I understand the situation. We are dealing with a very grossly different number of people on the island than the number being used to make these determinations, and that's frustrating, I think, across the board. But the ability to work with the Department of Public Health to understand better about the cases is where we are really able to make certain determinations. I think in larger communities that don't have a small group to work with and looking at specific cases that way, perhaps it's a little bit more challenging. Happy to ask Roberto or other folks who might want to chime in on this.
Yes, so while you were speaking, I actually just looked up Framingham Public Schools, and they've been in the red for a few weeks at this point, and they're actually in hybrid mode. They are having some in-person training, in-person schools. I didn't have a chance to check Everett, but To my knowledge, Everett Public Schools also has some level of in-person. So the commentary about how we're the only school district in the red that is not in person, that is fully remote, just by a simple Google search of 2 of the 10 red communities already shows us that that's also inaccurate. So it's just it's really important to understand when we go forward with these sorts of plans that we stick with as much of the empirical evidence as possible, because it is such an emotional issue that we need to stick to as much of the data as possible.
Thank you. Alice?
I didn't watch it in real time, but I rewatched a recent Board of Health meeting where Mary Lepre, I believe, I don't want to misstate what she said, but stated that being in the red would grant Nantucket a better opportunity for more testing. I would like to question if we're working towards getting like asymptomatic testing available to our island. Back when I could watch the governor's releases in the middle of the day, I believe he referenced that they had testing units that could come. Are we going to have any of those? Because I think we're looking at 3 or 4 weeks of being in the red mathematically. So can we take advantage in the red?
Absolutely. We're looking into taking advantage of that right now. We have an email exchange right now with the state. I'm blanking on what the term CEIT stands for, but it is their Emergency Operations Center team that we're working with. So we're connecting with them. And really what it comes down to is if the state finds it necessary to bring that asymptomatic testing to us as well. We had originally asked about it, and they had originally said only symptomatic, but we fired back saying everyone else gets asymptomatic testing. How do we not? So I believe that we're in the process of getting that asymptomatic testing. We just don't know when. We still haven't received that final answer.
Thanks. Jen, you want to move on?
Julie Kingston. Julie, are you there?
Julie, you might be muted.
I'm not able to unmute it right now. Julie, I'll come right back to you. Kate, Garrett?
Hi, can you guys hear me?
Yes, we can.
I just want to thank everyone so much for their time. This is awesome to give the town and everyone a voice. So much appreciated. And this has been touched on a little bit. Roberto, I did want to say Chatham, when they were in the red, they also went back to school hybrid. I think much like Nantucket, they realized we're a unique population and we have a unique situation that, the number that put us number 1 on the list was 10,000 people. That's vastly incorrect. And I think we can all just, look around or drive around the island and realize there's thousands more people than that. So I appreciate you clarifying that. It's great that, the numbers aren't tied to crowds at restaurants and bars and movie theaters. So my question is the only reason the kids were being uprooted and forcing, to be home, is it only because we were in the red zone, which isn't even really a correct zone? Like, why haven't they even had the chance to go back, since they haven't contributed, obviously, to any of the peaks that we're experiencing?
So let me explain, Kate, thank you for your question. When we made the decision to move to the red zone on September 10th, in our first September surge, we were in guidelines, which was when you are in the red, the original guidelines that were from July. And when you're in the red, you should be remote, and that was the discussion. On September 14th, 4 days later, we received new guidelines or a letter stating that we needed to look more carefully at data. So that is the reason why why remote happened, so to speak. If things had coincided differently, perhaps we would be looking differently at the data and understanding better. It's just a question at this point of timing, and having made that decision for 2 weeks, it was important to follow through with it for teachers, for students, and the ability to allow those 2 weeks to understand better where we were with the surge. We didn't know it at the time. I worked closely with the town, with Roberto Santamaria, with the hospital, school committee, before that decision was made. It was not something that was taken lightly. It was what we thought was best. And again, like I said, 4 days later, there was a different view brought to the table, and now we know better, and we know what we need to look at carefully before making any decisions like that.
Awesome. Thank you so much. That makes sense. I do have one more question if I'm able. Do we know if the hospital employee who recently was diagnosed was at a workplace transmission at Nantucket Cottage Hospital, or was that in the community or home? Is that able to be shared?
Well, we do know that that was a community acquired infection.
Okay. I actually think that would help kind of calm some fears in terms of acquiring it in the workplace. So thank you for that.
Alice?
I was hoping to get some clarification on the red zone or not. I've heard this bounced about, and I feel like in the beginning, when we first went in the red, it was the numbers are wrong. We're really not red, we're yellow. Yet in reading Twitter, those who know me knows that's where I get my news. The hospital and the town both retweeted the fact that we're in the red zone. So I'm concerned when I hear we're not in the red zone, we are in the red zone. I just would like clarification from someone. I realize we don't have an exact population. Are we in the red zone?
We are officially in the red zone because we have to go by what the state uses. So official numbers puts us in the red zone.
Steve?
Sorry, it took me a second to find the mute button. It's so hard to remain mute. I have analyzed the state's formula for determining when we are and are not in the red. And I've applied Roberto's desired population of 17,000, which I don't disagree with, by the way, Roberto, because our former, now tragically deceased town clerk was saying for years that we were approaching that figure. I understand the state's formula. I have run the first week that we were in the red, the second week we're in the red, and the week now, and we're still going to be in the red all 3 weeks using 17,000 as the population. So I'm hoping that y'all will be taking that into account. Even with your desired population, we're still in the red all 3 weeks.
So I assume that was a statement, not a question. So I would suggest that we move on. I know Julie Kingston had a question. She's here, but muted.
And Dr. Hallett, I wanted to comment at some point if I could.
Oh, that's fine, Garrett. If you'd like to do that, Julie, I know you just unmuted yourself. Hang on 1 second. Sorry about that.
Thank you, Dr. Hallett. And I lost my video. My signal became unstable, so you can hear me via audio. It's interesting when we look at the numbers of COVID per 100,000 and being in the red or not. And it's recently been written that those communities that have been successful in driving more testing have found more cases. And so as a result have gotten to red because there's more availability of testing and you're finding cases. So that's not necessarily a bad thing. And I think that's why Commissioner Howlett and the town and Roberto and I, when we met with the state, understood that red is, it's a category, but it's not a mandate. And it shows that, a trend, if you have a trend over time, that's more of a concern to look at. But more testing is going to drive higher numbers. It should. Unfortunately, the mathematics that are being applied don't take that ratio into account. I do think that you have a safe community with the capability that you have at hand. I just wanted to add that to that comment.
Dr. McNabb?
Excuse me. I just want to point out we have a great advantage over a lot of other communities because we are small, whatever the number is, 10,000, 17,000. We're better able to do tracing than most communities. So we really have a sense of where this disease is. We really understand the clusters. So it makes it a lot easier for us to make decisions. As I said once before, at the beginning of all this, we just did a shotgun. We didn't know what the hell we were doing. And now we have the data, as everyone keeps saying. So we can tailor what we do to specific clusters, to specific individuals, and to specific events. So red or blue or green, whatever we are, we have that advantage and we can't forget that.
Thank you. I'd like to let Julie ask her question. She's been waiting a while. Thank you.
Thank you. It kind of falls on the heels of what you were just speaking about. So am I to assume then that regardless of what the number is, what is most important is whether it is, I guess, an infection that's contained within a certain catchment area or population of people so that it can be easily traced and managed, as opposed to focusing on the number?
I think that's very important and a very sharp question, because I will also correct myself. Our hospital employee was exposed, had a known exposure. So somebody that she knew was diagnosed, and as a result, that employee came in for testing. That led us to find her people that she knew she had exposed, and those people have come in for testing. So exactly as you described, once we find a positive person in our community, we can then contact those people who have been exposed to that person, and by that method contain it as much as possible. So yes, we will probably see in the next coming days more positive cases because they will be related to these people. But then I would think people will start to mitigate the spread by isolating and quarantining and having an increased awareness of what led to those exposures. And behaviors will change again, and we will all stop drifting, as Gary mentioned, in our behavior out in the world, that it's not okay to go back to various activities that involve close contact with lots of other people. And so yes, it's important, and we're very fortunate in a small community to be able to do that very quickly. And so quick testing is really important, and tracing and isolating. So I think that if this continues in little spikes throughout the winter, we can contain them exactly as you were talking about, Malcolm.
Thank you. Anything else, Julie, or did we answer your question? I think so. Jen, you want to move on?
Sure, real quick, I just wanted everyone to know we have 11 people now participating who have questions. We have we've had up to 500 people monitoring the YouTube, and we have probably another 10 questions going into the public comment. So, Bobby Planzer.
Thank you. Can you guys hear me?
Yes, we can.
Okay. We have seen, hi, Bobby Planzer, junior at Nantucket High School. We have seen a lot of cases on island, even though we're all still remote, and I'm going to be remote. I'm very worried about my friends going back into school. You know, we could see cases going up. So my questions for Dr. Hallett, are we gonna shut down the schools and remain closed? Because if we see a spike, then everybody's gonna all be remote. So thank you.
Thanks for your question, Bobby. I understand your concern, and I completely understand. You've got friends that you're worried about. You're going to be remote, but your friends are coming in. I think there are a lot of things we need to think of. Number one, you've heard a lot of people talking today about how we are going to be very, very strict and vigilant about wearing masks, about keeping 6 feet distance, about washing our hands. And it will be very important that as we bring students into the schools and allow for learning to happen in person, that is very strictly adhered to and that we are following those guidelines. Remember also that we have a lot fewer students coming into the schools because of our hybrid model. And we will absolutely be checking and finding out and understanding if there is anybody who is not well, or and again, parents need to make sure, students themselves need to make sure if they're feeling any symptoms that they should be staying home, and they should be monitoring their symptoms. If they're not feeling well, they shouldn't be coming to school. It's really important that we all take responsibility for making sure that we are protecting ourselves and our health, and also protecting our friends, our teachers, everyone. The schools will only shut down if there is a need to do that, if there is a spread within the school with heightened cases. And I will work very closely with Mr. Santamaria, with Mr. Shaw, with Dr. Pearl, to determine whether or not we would need to do that. I think you've heard a lot of people talking about contact tracing and things like that, but I want to assure you and your friends and your concern for your friends and people coming back to school, that the most important thing is that we remain, that we continue to do the things that we've been talking about for so long: washing our hands regularly, wearing a mask, and staying 6 feet distance. So I hope that answers your question, and I hope it makes you feel a little bit better. You want to go on, Jen? I think we're good.
Lauren Murray. Lauren, are you there? We'll come back. Kendra Murphy. Kendra?
Hi, can you hear me?
Yes, we can hear you.
Okay, a couple of questions that I have regarding kids. Yeah, can you hear me? Hello?
I was saying, I think Kendra, you're on, and Lauren, you're muted. So Kendra, we'll start with and then go back to Lauren. Is that okay, Jen? Yes? Okay. Thank you. Go ahead, Kendra.
Just a couple of questions. From what I have heard, and I'm, not in the medical field, but children tend to be asymptomatic even if they might have that virus. So I'm wondering if they're like, for example, the colleges are very strict with their students. They have required testing, to make sure that a big spread doesn't happen throughout the school communities. So what is our plan for student testing, and is there one? And number two, if a student does test positive, if a student shows signs at school that they're ill, what are going to be the requirements for that student to return to school?
So the first part of your question is about testing. We don't currently have a plan for testing all students. That does require, that is it's something we need to be careful of. It could be considered a civil rights violation. So we certainly encourage any parent or anyone who would like their child to be tested to inquire about that. The more we know about testing, the better. And of course, Nantucket Hospital and Roberto, you're welcome to chime in here. But certainly that is something that we don't have a plan to do also, simply because that's a lot of students and it would require a lot of setup. And we're happy to support people who would like to look into that personally. With regard to your other question, I might call on Sarah Brooks if she's willing to share kind of what our plans are. She's our COVID liaison and is helping us kind of navigate through how we will deal with a student issue if that happens within the school and when they would return.
Okay, thank you.
Hi, thank you. So basically, if a student is ill in school, they will have a mask on their face. So they would be brought to there's a specific waiting room in each school that is for the sick kids. There would be an assigned staff member in full PPE doing vital signs or whatnot, and depending on the symptoms, would be decided if it's COVID-like symptoms or not. And then if it is decided that it is COVID-like symptoms, they will be sent home, encouraged to get tested. Again, they would go to the hospital and be evaluated to get tested. That's where our little disconnect of some things that we might portray as a symptom, and then depending on what the result of the test, if they do get a test, would then determine the next steps. If they're positive, I quarantine off the top of my head for 10 days, and then any close contacts around them would be 14 days. And if it's a in-home contact, it would be 14 days from the end of their 10-day exposure or quarantine time. And then depending on where that student is in the classroom, that's when I have seating charts for most of the classes, and we'll work our way with Department of Public Health and do close contact tracing then. Does that answer your question?
Thank you, Sarah. We appreciate having you to help us. Next question, Jen. I think Lauren Murray is in the queue, correct?
Can you hear me now?
Yes.
Okay. Thank you for holding this forum and giving so many people an opportunity to ask questions and share comments. Along the line of thinking of the quote unquote presumption of risk that Roberto shared in reference to restaurants and other industries remaining open, even though we're in the red, I'm wondering if information could be shared with the community, if not at the very least with school staff, whether any of the recent positive cases have been either NPS students or individuals contact traced back to NPS students. I think it's really important for school staff to receive this information officially and readily, rather than by a rumor mill, as it has been happening, because I think that has a huge impact on how safe we feel at school. As you know, school staff, we're the ones that are experiencing this particular type of risk, that being in a single room, that's a non-sterile environment, unlike a hospital, with a group of children for hours at a time. Thank you.
Roberto, do you want to follow up?
Yes. So one of the things that's really important to understand about contact tracing, COVID positive situations, things like that, those are personal health information. That's protected by law. So what we'll be doing, we do have constant communication with Dr. Hallett and I, and if there is a case in the schools, the school administration will know. But as far as which specific student goes, no one's going to know which specific student because we've already seen the way people react when specific names are known. So what you'll be, if you were in direct contact with a case, you will be contacted through our contact tracers. So that person will give us their information. We'll go back and trace what the contacts are, and then we'll contact the contacts directly. The most that will be known and trickle down is that there was a case in schools. But if you're not contacted directly by a contact tracer, then you were not directly in contact with the COVID positive patient.
Thank you. Do we want to move on to the next question?
Booth?
Hi, is that me?
Yes.
Thank you. So first, like everyone, I want to thank everyone for being here tonight and taking the time. I know you're all on so many meetings during the week, and I think it's really important for parents and community members to be able to ask questions because, as it's already been stated, a lot of us have been getting news from Twitter, social media, rumor mill, and I think it really helps to hear from the people who know the most. And so this is more of a statement for fellow parents, teachers, community members to just really listen to all of the information we're getting tonight. So the people who know the most. So as Roberto was just saying, there's a lot of proprietary health information that cannot be shared. But all the people who actually know all of that, the details of all the information, the hospital staff, the health department, the head doctors, everyone is encouraging school to open safely, open in a hybrid manner, and to evaluate. And so I think I am fully in support of the data, speaking for the data, and supporting all the experts in the room, in the quote unquote Zoom room, who are encouraging the opening and in a safe way. And so I just want to make sure everyone's really hearing from the people who know the most that that it's safe to do so. So thank you.
If I might also comment on that. Thank you. I really appreciate that. And it's a little troubling that I keep hearing over and over again that we get our news from social media. Social media is not a good news source. It is a rumor mill at best. It is really important to get the information from as many of the experts and validated news media as possible. It is like Dr. Boyce just said, it's dangerous to just listen to rumor mills. And I think that's all I have to say about that.
Thanks, Jen. You want to move on?
Anthony Supa.
Good evening, everybody. I'm still a little frustrated hearing what everybody is saying and some of the things that we're referencing in terms of safety protocols. I have been following these school committee meetings since February and coming to almost every single one. I think there's only 3 or 4 I missed when I wasn't around during the summer. And, we had this big meeting at the end of August saying it's safe to go to school. We'll have the safety protocols. There's still things that haven't been done that we said would be done more than a month ago now in order for us to attend in the first place. Within the high school, we still don't have accurate class size numbers for the rooms that we're in. They only have class size numbers if there was nothing in the room. which isn't accurate because there are people, there are desks, there are equipment that teachers use. So that's really frustrating. And, you know, I think another big thing that is just extremely frustrating is that, like, I get it. I said this last week or 2 weeks ago when we made the determination to delay, was that we need to listen to the healthcare professionals. But it's also very frustrating because it feels like every time we have one of these meetings, there's an agenda that's being brought into this and trying to push back to school. And I get that, but at the same time, when we look at all of these things, you know, we have Dr. Fauci who's on top of it all saying, you know, we need to be cautious. We need to take precautions. We have safety protocols in place. However, students aren't going to follow them. We've already blanketly said we are not going to follow them. We put in our NPS safety protocols that students are supposed to be washing their hands upon entering school. We've basically already said that's not going to happen at the high school. So for me, it's just very frustrating to sit here and listen to all these things about, yeah, it's going to be safe. Maybe if everybody listened and did everything they were supposed to, but I think the fact that we keep having spikes is a clear indication that people aren't going to do that. Thank you.
If I could just respond quickly. First of all, I think I understand where you're coming from, Anthony. It is challenging. This is going to be, you know, it's going to take everybody's effort to make sure that we are doing exactly what we need to do to stay safe. I understand the hand washing situation, and I also understand that it's going to take us some time to find our routine and find how we can make sure that we are mitigating to the best of our abilities with students coming in the building. I understand where we're at. I'd love to offer Mandy Vassal the chance to speak to this. I know she was interested in saying something. So Mandy, I'm going to let you speak to that.
Thank you, Dr. Hallett. I'd like to speak on a couple of things that Mr. Supa said, and I do appreciate his comments. We, you know, continually open up our faculty meetings for comments such as this because we also are concerned and, you know, want to make sure that we're open-minded and that we're listening to our teachers because we do care about their safety. One of the things that I would like to share with our teachers and our parents, and particularly if we have students that are listening, we have had a group of students that have been working with us since we started with the student forum, I believe, back in July. And some of those students actually just helped us work on a safety protocol video that we're pretty proud of and that we're ready to share out this week. And some of those students I felt like were very forthcoming whenever we were working on this video and said that, you know, some of them have worked part-time jobs all summer. They have followed a lot of these same safety protocols throughout the summer, and they feel like it's just second nature to them, wearing face masks, washing their hands, using hand sanitizer. So a lot of our students are actually, they're used to this. And so they don't feel like that this is something that's foreign to them. And yes, we're certainly going to have students that we're going to have to work with. And that's why we're doing everything we can to make sure that we're getting information out, that we're sharing information. But I'd also like to address about the class sizes and the class numbers. Those numbers have changed and we continually keep working with those. We have countless times asked teachers to work with us. I was in a classroom working with the teacher today. Demo, our building supervisor, has worked with us. We have made adjustments. We move furniture around. We've changed different kinds of desks. We're doing everything we can to ensure safety, to make sure that we're maintaining the 6-foot distancing. We've tried to compromise with teachers and have tried to make sure that their work area, that their area around their own teacher desk, that they're comfortable, that they feel good, and that they feel safe as well. And what's happened with some of our student numbers in classes is that as we've had to change schedules, it also does cause an adjustment in class sizes. for our counselors who have worked countless hours, and kudos to them with all the work that they have done. Not only are they having to look at class requirements and graduation requirements, but they're also having to look at our cohorts and keeping class sizes in mind as they look at the cohorts and everything else that comes along with it. So trying to juggle all of that and ensure that we're keeping everything in mind, and trying to make sure that we're getting what's best for our student and keeping that in mind, because that's really what's important, is what is it that our students need, and making sure that we're addressing those graduation requirements and doing the best that we can to get our students into the building.
Thank you, Mandy. I think, Diane, did you want to say something? You're muted. We can't hear you. I'm wondering if it's your computer. That's okay. We'll move on. You can come back at later and share if you need to. Jen, you want to move on?
Certainly. Kelsey Perkins, are you there?
Yes, I'm here. Can everybody hear me?
Yes, we can.
Great, thanks, Jen. So I think for me, for those of you who don't know me, I am the high school nurse. I think I can speak for everybody here when I say we have a mutual goal. The goal is to get all kids back in school. However, right now we are a community that is totally divided. And I think in order to begin to deal with this division, we need collaboration. That collaboration has to occur between the town, the schools, Board of Selectmen, Board of Health, school committee, and the hospital. I think, there needs to be an unwavering understanding between the town and the hospital that the schools, that we should return in person. However, in returning in person, there will be innumerable children sent home weekly, district-wide. And this will all be due to the new Department of Education guidelines. I truly want parents to feel confident and feel safe and secure that we're keeping our kids and our school culture safe. However, there needs to be some clear understanding that this will lead to more interrupted work days and more kids ultimately being sent home. I really feel like we need the support of the hospital desperately in regards to testing, because while I respect and appreciate Dr. Pearl and Gary Shaw's reassurances, in all practicality, I can personally attest to the fact that these are not being followed. Families are being met with misinformation. They often arrive, wait in line for hours to be turned away. And you can reiterate that this is not fact. However, in dealing with this firsthand over the last couple of weeks and being an educated clinical provider, I can assure you it is. Families are not adequately prepared to deal with quarantines that last 14 or more days, nor are they supported to do so. And so leaving here tonight, I just want some sort of reassurance that whatever approach we take will be decided and unified as a community. And that's all. Thank you.
Thank you, Kelsey. Is there anyone who would like to respond?
I feel like the reason all of us we're here, the town's here, the Board of Health's here, the schools here, the hospitals here, this is a declaration of unity. I think, what more people do you want at the table? We have the whole group, and we're holding a public forum that has over 100 people in the Zoom attendance and over 500 people in YouTube attendance. So I feel like the science is pointing us in a specific direction. There is no agenda in science. A proper scientist will remove that sort of bias. And as I was saying earlier, the empirical evidence is showing us to move in a specific direction where the hybrid works. So I believe that we are moving together in collaboration. And I know more other people will have comments as well.
If I could just mention one more thing, I do want to remind all of us of what Gary and also Dr. Pearl have mentioned, and that is our testing. We do have some options. We are looking at bringing more testing in. We have a different style of testing, which will potentially give us better opportunity to test more people, et cetera. So I agree, and Kelsey, I definitely hear you and understand where you're coming from. And I'm hoping that this is just the start of a stronger collaboration across the town and the community, that we move forward with that. So, Zona?
I just want to, comment on Kelsey. Thank you, Kelsey, for your comment. What I would like to do is, I'd like to ask the real question. What does it look like differently to you, Kelsey, that can be done? So we need to start thinking outside the box a little bit, and maybe have a little bit more, I think, and this is just my opinion, real conversations. So I'd love to hear what Kelsey has to suggest. Maybe she has some ideas about how do we help equip these families that are not prepared for these 14 days, quarantines and things like that. Every little bit helps. Education helps. People have to feel comfortable. There are so many unknowns here, and yes, we do have the experts in the room, but you know what? The person that has all the answers is not on this Zoom call. He's in the air. Okay, we just can't see his face. I think you guys know who I'm talking about. So, Kelsey, I'd like to encourage you to have those conversations, and let's think about those ideas to help the community, to help us all be a little bit more succinct and in cooperation. Roberto, we are, like you said, we are all here together talking about it. There's no doubt, but I think there's some outside the box thinking that needs to go on to help bring us a little closer to being on the same page, if you will. I just wanted to make that comment.
Thanks, Sona. I'm going to move us on, Jen.
Jodie Patterson.
Hi, can you hear me?
Yes, we can.
Hi, I am a parent of a CPS student, so I've been around the school system for a little while now. And I just want to thank the many, many teachers and staff that have participated tonight and shared their fears and their thoughts and their ideas. But I want to share with you that many of us that were quarantined or remote working also were very afraid when we went back to our jobs, or into the offices or wherever we happen to work. And I do hope that you take some time as you go back and develop new habits and learn how to live this new normal, because it's not normal. And we all admit that. But I also wanted to point out that, as the hospital and Roberto have said, over the past 6 months, we've had people out in the community, summer camps, kids participating in sports, the Boys and Girls Club, and those places have not had large outbreaks to my knowledge based on children. And I'm hoping that that is going to be the case when we do reopen schools, because just like all of us need to go back to our offices and go to the gym and, go to the market to feel some sort of normality again, I feel that our children do as well. So that's my comment. And I hope that you do take that with all of the care and concern that I express it with. My question to Roberto would be, we're doing all of this new testing and contact tracing. Are we going to at some point receive data on the positive cases that are symptomatic versus asymptomatic? Thank you.
That is an excellent question. And now, and as you mentioned it, I really wish I started collecting that data from the very beginning. I'd have to go back and do data mining now. That's a very good question, and I'm gonna do my best to mine through the data that we have, so that I can see if I can tease out information on asymptomatic versus not symptomatic. That would be very, should have thought of that, and that's an excellent question, and I'm gonna do my best to get that data together, and I will hope to have it by next week's select board meeting.
Thanks. Jen, you want to go on?
Hadley Dutra.
Hi, thanks for taking my question. I just wanted to start also by thanking everyone for being here and for the collaborative effort that is being shown here tonight. It's very impressive that we have the hospital, the school committee, and the town principals, the superintendent working together. It's a great thing. On that note, I'm hearing a lot of things that a lot of people are saying that are very similar, and we're all here because there's over 1,500 students sitting at home right now learning remotely. And I think that's why everyone is here and everyone's concerned. I'm the parent of a first grader learning remotely and fifth grader. And I see the effects of, especially with my first grader, of remote learning, where he's, simply not learning enough. He's socially distanced, in a bad way because he's not with his peers. There's all kinds of ramifications that are so negative with remote learning. So I find that until we all decide that this is unacceptable and work together collaboratively, nothing is going to change. And I love the idea that Zona has said, bring something outside the box to the table. That resonates with me, because I think we need to do something very different here in order for students to return to school. I don't know if that means the town needs to enforce stricter measures as far as enforcement for people who aren't following social distancing and wearing masks, or whether it means more testing, whether it means better contact tracing. I'm not sure, but I hope that this group can collaborate more together so that we can find those outside the box solutions. So I guess my question would be, are we going to collaborate again? Is this group going to collaborate again so that these students can return to in-person learning?
So certainly I will speak for the public schools, and that is, we would be happy to collaborate. This is impossible to do as a single entity. We need to have the support of the entire community. And it is challenging when there are such differences. It's also normal, I would imagine, that every community in the world is perhaps seeing some of these similar situations. But being that we are on an island, and for better for worse, we are isolated, it brings us to a point where we have to collaborate, and we want to collaborate for the best of our children who are our future. So I hope we can continue, and I hope that we are able to meet again at some point. Certainly our first step is to move in the right direction to bring students back to hybrid learning as best we can, if and when it is safe. And it sounds, in many ways, we've heard a lot from the hospital, from the Department of Public Health, and hopefully we will be able to do that very, very soon.
Dawn Holgate has her hand up.
I just wanted to mention, with all of the people here, because they won't necessarily know, but we have been regularly collaborating between school administration, the Board of Health, the town administration, public safety, and members of the Board of Health have been involved on every time that we have a surge in cases, that we do get together and do a very solid recheck on what we should be doing as a community. So I think that this forum is amazing, but we are having smaller groupings of people working on this.
Thank you, Dawn, for adding that. I should have remembered. Much appreciated. Jen, you want to move us on?
John Lavenberg.
Good evening, everybody. This is John Lavenberg from the Inquiring Mirror. I just wanted to be clear for the record. Are we saying officially tonight that the schools are starting the hybrid Thursday, or is that official decision still to be determined? And if it's not, why wait until tomorrow to make that decision, given parents have to figure out their situations and how to work out the hybrid model? Thank you.
Well, way to put me on the spot, John. I reserve the right to have some time to think carefully about this, along with others here on this forum. And I have announced to the school staff, NPS staff and school committee, and others as well, that a decision would be made tomorrow. So I'm going to hold to that decision. And if anybody else wants to chime in, please feel free. Dawn, go ahead.
I think that the forum tonight was to get all of this input so that Dr. Hallett could think about this carefully and make her decision.
Thank you.
Tracy Maylou.
Hi, I think my question is probably for Mr. Shaw and Dr. Santamaria. I'm curious about the positive cases that I know it doesn't happen often, but when somebody retests because of a false positive, I'm wondering if those positives come off of our town count or if they just get lumped back in and built upon.
So for the sake of contact tracing for us and to err on the side of caution, anytime we get a positive, we treat it as positive, even if there is the possibility of that case being a false positive. With the risk of spread and the risk of uncontrollable outbreak, I think we have to err on the side of caution and treat all the positives as true positives, even if there is always the possibility of it being a false positive. And if the hospital wants to correct me on any of that, please do so. But I believe that's at least how we've been doing it.
Okay, let's move up. Dr. McNabb, thank you.
I'm sorry, just out of my own interest, do we have a sense of what the rate of false positivity is on the island?
On island, it would still be too hard. We've only had
too small.
It's too small of a N of a subgroup.
Okay.
But nationally, they've been ranging anywhere from a 9% false positive rate all the way up to a 30-something%, depending on the test they're using.
Thanks. Shall we move on?
Anthony Supa.
All right, sorry, thank you. There's just two things I wanted to briefly just kind of get your professional opinions on. Keep hearing how the Boys and Girls Club and the community school ran successful summer camps. And I would just like someone to compare the summer camp environment where kids are choosing to go there for fun and enjoyment versus potentially being stuck in a classroom doing something that they don't like in terms of math or English or whatever it might be, and how you expect that might play out. And then secondly, I would just like to make a comment directed towards Roberto and that your frustration a few minutes ago and saying, you know, what more do you want from me? I feel like a lot of teachers feel that way. In the past couple of years, especially, you know, we have to do lockdown shooter drills and we have to prepare for school shooting drills. You know, I think at the end of the day, we just want to make sure we're safe. And on top of being safe, we want to make sure that the school system can you know, I know we can't guarantee it, but get as close to a guarantee as we can. And as I stated earlier, I don't think all the safety protocols are already being followed. So I feel like that's hard for a lot of people to feel that way. Thank you.
So I'll address camp. Of course, camp can't necessarily be compared to school with regard to many things. Number one, children do choose to go to camp. Parents do choose to have children go to camp. It's a summer activity. It's fun. It's different than school. But with regard to health and safety and what we were able to do, it was really one of the first experiences of having students together, having children, very young children together, following protocols, working together, learning how to wear masks for a good long time, learning different styles of games, things like that. Of course, that's different. I understand that it's not the same as sitting in a classroom and learning math or other things, but I think that maybe this is just me and my positivity, but we are creatures of innovation, and we will find ways also to continue to learn and grow as we adapt to a new normal with regard to masks, with regard to the way we're learning in classrooms. It is different, and I don't think we can make a real comparison, but I was thrilled to see children who were enjoying themselves and still able to follow protocols. And I think that was an important piece for us to have been able to see happening over the course of the summer. So I appreciate that. Paige, you had a question? I don't know if I got to all of the answers for Anthony, but go ahead.
Yes, thank you, Beth. My question is, building off of the experience of summer camps, which involved a fairly small number of students and staff really testing out what the protocols are like. And obviously they were outside as well, which I think is an important consideration. But I'm just wondering if you and school committee have thought about welcoming back the A cohort of students first. This is actually something that the union presented a while ago, the idea of a phased-in reopening, so that we can see how the protocols work within our classrooms and in the hallways, and iron out any things that aren't working, similar to the idea of summer camp, kind of seeing for the first time how that works. Most of the teachers who are working in the buildings right now did not teach the summer camp programs. We're not teaching at Boys and Girls Club. I think having a fewer number of kids rather than having A and C returning on Thursday might alleviate some of the concern and allow us to better prepare for the full group of kids returning. I mean, I'm asking that because it seems as if in this flow of this meeting that certainly coming from the hospital and the health department, that they're believing that a return is safe. And I'm just asking from a teacher's point of view, if we can have fewer kids returning in the beginning so that we can iron out some possible issues that may occur and alleviate some of our concerns with having so many kids in our classrooms. Because I'll be honest, there are, and certainly this is at the high school, we have some classrooms that are going to have 25, 24, 23 students in them. That's a lot of big teenage bodies. I love them all, but that's a lot of them. And to have fewer than that and just see how things work out and get the A cohort kids understanding the protocols so that then we can fold in the Bs and the Cs, I think might help.
So there's been a lot of discussion about many different options. I can't make a determination right now as to which option is going to work best. The district leadership team has talked with me about different things. School committee, we've discussed things. I've discussed with with many people. So I understand the concern, and everything is being considered. I can't decide at this exact moment and wouldn't be able to share that right now. There's a lot that I would like to think about, particularly before we head into that decision. And so thanks for addressing that, and I will certainly let you know. Jen, do you want to move us on?
Yep, Kate Garrett.
Hi, thank you. So I just wanted to say this has been such a beautiful collaboration. Thank you everyone so much. It's really been heartwarming to sit here and hear everyone's remarks and concerns and questions. I don't have another question, but I do want to state, I think that so many children home, it has been very taxing for them. There hasn't been any specific comments from parents, but I've had friends whose kids have said they're getting migraines on the regular that are forcing them to throw up. So, excuse me, I do think that it is a very important concept to think of the other side of this too. I get the teachers' fears. I certainly understand that. I just think that science, like Roberto has said, you can't fight the science. The facts are there. And Roberto, did you say that less than 100 cases have been all across the state of Massachusetts in all school districts?
Any cases of spread. So where more than one case where the case had jumped out of the school, less than 100 cases. That was from the National Educational Association. I don't have the exact website on me right now, but I know Mass 211 Live or Mass Live put it up today, so you can just Google that information for now, and I'll get the information out to Dr. Hallett so she can probably push it out if she can.
And then, for the high school teachers who are saying they're going to have 25 bodies in a room, I'm assuming that they still have to be 6 feet apart. Is that correct? The classrooms are just that big to fit all of the students?
Yes.
Okay.
Yes, they will still be 6 feet apart.
Okay. And kind of on that same note, I want to remind everybody who is going back to school, everyone will be masked. And before we say that children can't handle this or won't wash their hands, I think back to March, and I think what the town of Nantucket did to basically kill COVID from March until June. Obviously, after that, it was out of our hands with tourists coming in. And, on the same token that it's going to be very hard for families to quarantine, I look at what families have done since March. They've basically given up their jobs to have their kids home from school. So I think let's give more credit to the students and to the families. Look at what we've done as a town. Look at what all the families who reside in this town have done. And try to keep it positive. I think that people can do great things when coached and instructed the right way with love. So I get the fears. I work firsthand with COVID. I'm a nurse in the ER, so I had them too. And let's give people a chance without saying that they're going to fail.
Thank you, Kate. Mandy, I know you wanted to address something that Paige had mentioned, so I will let you go ahead for a minute there.
Thank you, Dr. Hallett. Yes, I just wanted to mention that because the size numbers keep coming up at the high school, and we do have probably, so to Mr. Supa's point, we do have a couple of gym classes that are larger, but they also do have the gym that is a larger capacity. I'm sure Ms. O'Neill could speak a little bit better about the actual capacity because I don't have that number right off the top of my head. There are some concerns for the gym teachers that particularly the class blocks that are all three of them are teaching at the same time. But we are, like I said previously, we are still working on some student schedules and trying to make some movement. Our counselors have worked tirelessly at that. We do have, we have one math class that we're still working on to minimize some numbers. We have one science class. I just talked with the teacher today. We have a couple of classrooms that could actually hold 20 students, but in working with the teachers, we've compromised because what they really need to hold are 19. So we said, you know what, if you're most comfortable with holding 19, then we'll try to make sure that we stay at 19 because we don't want the teachers to be uncomfortable. So we're not trying to overload classes. But again, our priority is to get our students into the building and into classes. We have tried with fidelity to make sure that we're not using up the library as a classroom space. If we really needed to, we could put desks in the library because we could hold more students there and make that a classroom space. But we haven't done that because we don't feel like that that's best for our students, nor is it best for our teachers. We also haven't done that in our cafeteria. It's not what's best for our students and it's not what's best for our teachers. So we really don't have classes that are 25 at class sizes. We have at the top, off the top of my head right now, I believe we have 2, maybe 3 that are over 22 in size that we're working on. And guaranteed that by the end of the day tomorrow, we'll have resolutions for those classes as well, because there was movement in a couple of, in some of them today. So, and the only thing I could say is that we're, again, and I've heard this previously, I don't know, I think it was either Sarah or Kelsey that said this, is that it's a collaborative effort. And we have countless times asked teachers to be patient, to work with us, to understand that we're doing the best that we can. Our counselors have worked over the weekends. One counselor I know spent Sunday working 7-8 hours trying to make sure that they're addressing as many possible needs that they can for teachers and students alike. So, you know, we're doing the best that we can, and it's all that we can ask for from them. So we're just asking for patience and bear with us.
Thank you, Mandy. I'm going to ask Jen to give us a count. Oh, Alice, go ahead.
I just wanted to quickly add in, I understand the need and the want to get back into the classrooms, but actually when we get there, it is going to look different. And there will still be a lot of work on computers because we've been advised that we can't be exchanging papers. We can't be sharing supplies and stuff like that with students, that their lunch will be in the classrooms, not in the cafeteria. Certainly if there's options to go outside and stuff like that, we'd be taking advantage of that. So I just want here as a teacher rep, as a co-president, that you know, those watching understand that once we're in that classroom, it is not going to look like it did in 2019. And my other question to the science that seems to be guiding us to a hybrid model, does the data coming in the following days, tomorrow, Wednesday, or Thursday, going to impact this? Or is there a magic number that would cause concern enough that we would want to change the path? Or is Nantucket secure enough right now that we can just move on with this model and be safe short of extremes, I guess? You know, if the 5, 6s keep rolling in, we're okay. Because the constant change is very challenging for our teachers, and I know even more challenging for our students. How do we plan?
So yes, one of the things that we're looking into is definitely that what the threshold is. And we're looking, you know, over the last few weeks, we've added things like the replication, the basic replication rate of the virus. There's a lot of things that go into that, of how many, like the question earlier, how many are symptomatic, how many are asymptomatic. I would say that honestly, moving forward we can still move forward, even if a few numbers still come up here and there. We're going to see cases that happen. And if we shut down every time there's a spike, we'd be in trouble, and that wouldn't be viable. To what happened earlier in the year when we ended up going when we ended up shutting down, what we ended up finding out was when we did do the shutdowns and when everything was there, we didn't know what we know about the virus today. We followed the science as much as we could. Everything from we circled the wagons around the science, and one of the things that really came out is proper hand washing techniques, proper PPE, proper distancing. All of that worked. So I think we know a lot more of the virus now, about the virus now, than we did even 3 months ago, let alone 9 months ago. So I believe that we should still move forward, even if we do get a few, 5, 6 days out, 5s or 6s out here, barring a big spike in cases and caseload, the R number moving into well over 2, then we would look into other extreme actions. But I believe as of right now, we can still move forward. And if Dr. Hallett, if you want to talk from a policy perspective.
I'm going to be working closely with you, Roberto, and with others to make those determinations. I mean, I think I said before, the fact that we're a small community gives us the opportunity to know more about the cases that we're seeing coming in and understanding and contact tracing differently. So I support the science. I support the medical data that comes out and helps us to determine what is really best. And I've said numerous times, students and their well-being is always at the forefront, and by consequence, teachers and their safety is also at the forefront. So I would never want to bring people in if it weren't safe. And I trust the science, I trust Roberto, I trust the hospital to continue moving in that direction. And I think it is true, we're never going to be 100% sure at all times. There will always be some doubt. But I think we need to see where we can go and get to that point where we are trying and feeling comfortable in doing our best in mitigating. And as we said, we will have masks, we will be washing our hands, we will be distancing, and that is something that we've promised to do throughout.
Can I ask, sorry, what is the R number right now? Is that the positive rate, or is that a different number that I don't know about? Like today, what's the R number?
The positivity rate is different. The positivity rate is how many positives you have for the amount of tests that you gave. It's on the Cottage website. I don't have it in front of me right now. The R number is for every one person that gets sick, how many more people do they infect? To my knowledge, right now it's still hovering a little bit over 1, because it's still just that individual, person to person. We're not getting 3 people sick for every 1 case. And we do have a good amount that have been imported as well. When I say imported, people who didn't get it here. So that replication rate is hovering in the 1s right now still.
And that's on the Cottage website, website?
The positivity rate is on the Cottage website.
Yeah, that I've seen. Where do I find the R number?
The R number I calculate every week and I put it on the select board, the PowerPoint. I haven't calculated it for this week, but I have been looking at the 7-day average today. I was hoping to get my PowerPoint and a video done today, but life happens.
Thanks. So I just want to do a quick check. I think we have 3 questions left. It is we're coming on 2 hours, and I want to respect people's time and make sure that we can still answer questions. So Jen, how many are left?
We have 3 people with their hands raised, and we also have 7 letters from earlier that went to the public comment email address for the town. And I think you might want to answer a couple of them.
Okay, so why don't we do hands raised first, and then we'll get to the other letters.
Mitch Blake. You're muted.
There, that should work.
Yes, we can hear you.
Yes, Again, as other people have expressed, I do want to thank you for the opportunity to be able to ask. I appreciate your dedicated involvement and time that you've spent in this whole venture. And I would also like to acknowledge that given that everybody has to deal with the facts of COVID, that I would like to acknowledge the additional burden of responsibility that you have for making difficult decisions. You're not alone in having to make those decisions. A comment I would like to make is I am somewhat conflicted about the necessity of physical presence. And it was interesting to hear that most of the classroom work is going to be done on computers anyway, so it will be an extension of the at-home. But I know that both of my kids are really eager to get back into a classroom. So I'm listening to them and what they have to do. And hopefully that will be something that will work very well. But I am in a particular set of circumstances, being high risk, and I would like to ask 3 questions. One about the ventilation systems in the school. How are they being dealt with? Are there daily admission protocols? For instance, just quick temperature checks for kids, because even though I know everybody is trying to be vigilant, that not everybody is, and some people feeling their invulnerability may just not be particularly concerned. And also, I was interested in hearing about the possibility of asymptomatic testing, and whether or not there is a partnership with the school and the hospital to be able to administer asymptomatic tests at either no cost or at a reduced cost, because it could be burdensome in terms of the cost of an asymptomatic test. But again, thanks for this opportunity, and thank you for all of your dedicated time.
So I hope to remember your questions. Forgive me. I'm going to see, Diane has had some challenges with her audio. Diane, if you're able to address the issues with air quality, if you're able, and if you're not, I will do my best to speak to them. No, can't hear you. It must be your device. What I will tell you is that we have gone through extensive HVAC system examinations and audits. We have brought in experts to check very carefully our ability to have good ventilation and appropriate airflow. And it turns out that each of our buildings is in compliance, if not even higher, with better airflow and air quality. So I think that attests also to the work that Diane and her team have done to make sure that our buildings are entirely safe when it comes to ventilation. So we are comfortable and feel confident that that is not an issue. And please forgive me, I think there was another question about asymptomatic testing, and I might ask you what your middle question was again, but perhaps the asymptomatic testing I could ask Roberto to address.
I think we mentioned it earlier about how we're having conversations with the state to see where we stand on having the state bring in their mobile testing center so that we can have that handled as far as asymptomatic testing goes. That should be, if we do get it, that should be free to anyone who shows up and gets the test. However, if we don't get the ones from the state, we don't have a full capacity, because it's expensive. We don't have a lot of capacity to be able to provide a lot of free or subsidized asymptomatic testing to the public. However, there is some grant money still available from a lot of members of the community who helped during the late spring into the summer to provide funding for that grant, for that asymptomatic testing program. We can look into setting up specific criteria to help expand that program, but unfortunately, without the state's help, the hospital will still need to charge for some of that.
Mr. Blake, was there a question that I missed? My apologies.
Yeah, I just first wanted to say to Roberto that maybe you should plug into your computer because it looks like your battery's getting low. Yeah, in terms of the asymptomatic testing, I mean, I think many people on the island are feeling the economic burden that the whole situation has placed on everybody. So I would hope that there would be some kind of relief for being able to administer those when necessary. My second middle question was just simply, are there daily admission protocols, for instance, just simple temperature checks to help to screen?
Thank you for reminding me. Yes, I knew there was one there, and it was on the tip of my brain. It has been the Department of Education is not using temperature checks as part of daily regimen, so to speak. What we are doing is we are asking parents in a daily email and message to make sure that they are screening their children. This is important that we're sharing this information, that we are educating parents that it is really important that they check their children's health before, and if there are any symptoms that they should keep their children at home. So we are doing our best to message this as much as we can across each school with different populations, et cetera. But a daily email will be going out with a reminder to do that every day to make sure that we are doing what we can. We also hope that we can continue to do some of that checking in with students, making sure that we're noticing as well as educators as they're coming in if they're not feeling well. All of that's going to be important, that we have opportunities to be vigilant and to be watching carefully. We want parents to really be the ones, and students themselves, if we want, at the older levels, at the upper schools, if they're not feeling well, then they should also be staying home. I mean, that's important. But we want parents to get into the habit of doing this daily so that they can determine whether their child needs to stay home. So we know that that's a challenge. Steve?
Didn't expect you quite so quickly. I want to compliment, I guess, or give a shout out to Roberto to keep chasing after the state for the asymptomatic testing. Fact is, we are already going to be designated red next week. I just ran those numbers, and with what we have already, that'll make 4 weeks in a row. And I would be outraged if they continued to say no when we've got 4 weeks in the red. And please feel free to tell them I said so. Thank you.
Thank you. Jen, you want to move us on to the next one?
Certainly. Vanessa Rendiero. Vanessa, you're muted.
Hello. Hi.
We can hear you.
Okay. Thank you for calling. I've been waiting for 2 hours. Thank you. I just would like to first of all just disregard my comment, okay? Because that's what I'm gonna say now. That I sent you by email. So what I wanna say is that as a parent, I have an NPS student too. So that's my comment. So COVID is not going to go away in the near future. So everybody knows that. So Nantucket is not on lockdown. All businesses have been doing their own businesses, attending so many people all day long. Everyone else have been doing their errands, all over the island. taking a walk, going to the playgrounds. The private schools are full steam ahead of providing full in-person classes. So why, as a parent, what I don't understand is why are the Nantucket public schools the only ones on the island that are making decisions differently by not providing full in-person model for the students? I can really understand, and especially for the younger ones. Besides, everyone in the Nantucket Public School is going to follow all the required safety protocols. And I think that I think it's still in place. I'm not sure, but it's out. The 3 feet is allowed by the Department of Education. The second thing that I'd like to express here is that do the safety protocols not work? I remember that 2 weeks ago, I watched the select board meeting, and I remember that Dr. Garrett told us, he told us that if about masks, and he said, for example, if one person has COVID and is in contact with somebody wearing mask and in contact with somebody else that is that doesn't have COVID, so the chance to get COVID, the healthy person, let's say that put this way, the healthy person to get COVID, it's 1.5%, if I'm not wrong. So it's almost nothing. So if like all the kids, all the staff, everyone else in the school, in the building is going to follow, the safety protocols, are going to, if everyone is going to wearing masks, so why, like, so that's what, as a parent, I really don't understand so many discussions on this. Because if I say as a parent, like I have friends that they just enrolled their kids in the private schools on island. So I'm thinking, so what the message those private schools are giving us, are giving me? So, and then what I'd like to ask to finish here is just to ask the committees, to ask everyone here, Dr. Hallett, is that please get the students back in school, for the parents, for the families, let them to choose what works best for them. They're going to use their decision is based on data, on the state and town data, facts, metrics, and science. Thank you so much.
Vanessa, thanks for your question. I will do my best to answer, and hopefully you can remind me if I missed part of that. So let me address the 3 feet versus 6 feet first. And you're asking, why is Nantucket Public Schools not following the 3 feet? The Department of Public Ed has said that 3 feet, between 3 feet and 6 feet is acceptable, no less than 3 feet. But 6 feet is the desirable distance in order to be absolutely sure that we are keeping an appropriate distance and mitigating or any sort of risk of transmitting the virus. We've worked very closely with our teachers union and teaching assistant ESPs to determine to determine what we feel is appropriate and most safe. So the schools are under different jurisdictions, so to speak, with regard to regulations as the private schools. And so the private schools have a little bit more leeway with regard to what they are able to do. The public schools have different requirements, and we are trying to do exactly what the recommendation is from the Department of Education with regard to spacing, with regard to our protocols, our safety protocols. I know that in-person learning is what we would all like, and we will get there eventually, but we need to have the opportunity to move there at an appropriate speed as we make adjustments, as we understand better how we are getting closer to understanding this virus, knowing how it's transmitted well. So that's, I'd say, the 3 feet versus 6 feet. We want to keep our students safe, we want to keep our staff safe, and we want to educate them as best we can with those parameters in place and the masks, et cetera. Please, if anyone else wants to jump in with this, I hope that you understand that that is our goal, is to move ourselves as closely as we can of getting more students in the building. You know, we do have limitations when it comes to staffing, when it comes to space. Again, safety is absolutely the number one priority. Private schools, I know, are operating in a safe manner as well, but it is different. It is different. They have smaller class sizes. They have buildings that have more space, perhaps, or at least can accommodate that. And they do operate under a different regulations. So it's important that we follow what the Department of Education's strictest guidelines have offered. And I think that's what will make everybody feel the safest. So I hope this answers your question. I know, you know, we are working towards getting students back in school. Jen, next one.
Maria Partida, and I'd recommend that be the last of the attendees with raised hands. And then I'll go on to read the questions that came in through the public comment.
Okay, thank you.
Maria, go ahead. You're muted.
Can you hear me now?
Yes, we can. Thank you.
Thank you for letting me be part of these the comments. And I know, and I have heard that the number goal for everyone here is to go back to school, and safety is our priority. And I see that it's going to be a 50-50 on parents deciding to bring their kids or letting their kids going back to school. I'm on that one. And the other one is they want kids to go back to school. Some students want to go back to school. My kids want to go back to school, see their peers, and see their friends, even though it's going to be under a mask, but they'll figure it out how to say, hi, I'm good, how are you? By blinking an eye or so. But I am not exactly sure if all of the teachers want to have their kids in school. And I understand that doing that hybrid type of learning, it's good because it helps have less kids in school, and letting parents decide if they want to have their kids going back to school helps as well to minimize that number of kids in class. And I know you're doing as best as you can to use the gym and the outside and the library as a classroom. That helps. And I see and I understand that you guys are doing the best. Working with the hospital and the town helps. Having Roberto here, who's the expert, I am not. So when someone comes and asks me for my opinion, I go talk to Roberto directly because he knows better. And numbers do count, do say the truth. My sister passed away from the COVID, so I do take this very serious. And as soon as I know that the numbers are going down on the positive cases on island, I'm willing to have my kids go back to school because I know they do want to see their friends again and their teachers. One of the things that I want to ask is, what would you do to help everyone in general, but especially the Hispanic students, which are the minority, but the most at risk, high risk, due to their parents having to work at the landscaping, painting, and house cleaning, them being one of the most positive cases, that to help them, they might feel being bullied or accused for others in school for that reason, and then them having to take the decision of suicide as a way to get out of it. And also that will be also reflecting their academic success. We don't want to, we are afraid of our kids being target of any type. And also, I know there's mental health available for everybody on island, and I appreciate it. I've seen it, I've shared it. And other thing that really bothers me is those kids are suffering from domestic violence, from someone at home being abusive to them. How would you respond to them? Because we don't want to fail them. That's it. Thank you.
First of all, Maria, I'm sorry to hear about your sister. I'm sure that was a challenge for you. So I have several principles. You have heard a lot of me talking tonight, and I would love to be able to lean on them if possible, to maybe share a little bit about what they're each doing at their schools in order to be aware and make some concerted effort to protect, to work with our needier population, our Hispanic students, what their needs are, how they feel, where they're at. A big focus this year is the social emotional learning of our children. We know that COVID has been incredibly stressful and traumatic for our children. And we really want to spend time this year having an opportunity to address that need. Having children in school and having the opportunity for them to have FaceTime with guidance counselors, social workers is very beneficial. But we also, as teachers and as administrators, want to understand more about what our students need and how we can support their social and emotional growth, especially in a time that is so traumatic. So I see a couple of principals who have popped up. Mike Horton, if you want to share what you're doing, that'd be great.
Thank you, Maria. And I'm also sorry to hear about the loss of your sister. We are back up and running with our school guidance counselors with weekly meetings to discuss students of concern. And that is a continued practice that's been in place at CPS for years before I began as principal this year. As Dr. Hallett mentioned, the district has a huge focus on social emotional learning, building trauma-sensitive schools, and that is underway as well. There are several other things that I could talk about, but in the essence of getting right to the point, something that is happening right now to address this is that at CPS, we are taking attendance every single block. In the past, attendance was only kept once at the beginning of the day during homeroom. And for the first time in my career, 20 years here, we are looking at those hourly attendance sheets and noticing who's been absent 3 times, 4 times, 5 times at different parts of the day, different blocks of the day. What that leads us to is a follow-up phone conversation to reach out and figure out why. What's going on with this student? And many times it's as simple as, Wi-Fi connection is not good. Well, then we work with the tech department to troubleshoot that. Chromebook isn't working right. Okay, you got a new Chromebook, we had to create a new update, bring it in, we'll get it fixed. Or, okay, you're still traveling back from North Carolina. Let's talk about that. Let's talk about, what the state travel order is. But what this has enabled us to do is every hour, not just like once a week, but every hour, look at the attendance sheet so no one is slipping through the cracks. To find out. There's been lots of phone conversations and follow-up where I have a pile right here crossing out, okay, that's the plan with this student. That's who's following up with that family. That's the situation here. This is what needs to be done. Social workers, guidance counselors, administrators are all working together as you always have. But the simple thing I wanted to share is that we're not missing kids, because if kids are on a roster and they're absent, we're looking into it on an individual basis, which honestly probably hasn't happened to this degree before, at least not at CPS.
Thanks, Mike. Is there anybody else who might like to chime in? Oh, I see a bunch. Eve Marie, go ahead.
Hi, again, I'm so sorry to hear about your sister. That must be so hard for your family. I want to reiterate everything that Mr. Horton said. The same applies to Nantucket Intermediate School. We have 2 full-time school counselors and a full-time social worker. In addition to that, our teachers are noticing every single day how our kids are engaging and how they're handling school, and who seems to be struggling with remote learning, and they're reaching out to me, they're reaching out to the counselors. We're following up to make sure that everybody is getting what they need, or trying very hard to give it to them, especially now while we're remote. It's much harder, but I'm still working hard on that. And I also wanted to touch a little bit on the idea of different populations of students being targeted. Our teachers through the Building Trauma Sensitive Schools work are very sensitive and aware of noticing any signs of students being singled out for any reason. And we would address that across all of our schools in a way that preserves a student's dignity and doesn't allow for that to happen. I think our awareness has been heightened, if you will. So that's all part of our social, emotional learning and teaching and growing. Thank you.
Thanks. Mandy?
Thank you, Dr. Hallett. I apologize. I feel like I've been speaking a lot tonight, but I just wanted to also kind of follow up to what Mr. Horton said. We started at the high school today with our guidance meetings also. We will be meeting weekly to talk about students that are needing extra supports. We took a look specifically at schedules today and some schedule movement that needed to take place, but we'll also be looking at those students that are having some difficulties with classes, those that might not be showing up for classes. We also have one of our teaching assistants who works with our L students, and she's been calling our L students every single day, checking in with them to see if they're having difficulty being able to get into classes. Is it connectivity issues or is it language barriers? So we feel like, we are already starting to put some of those interventions in place. And we've started opening up conversations with our new special ed director, Deb Gately, about our MTSS program and what we're going to do to start developing our tiered system. So we feel pretty good about what the work that we're starting at the high school and ensuring that we are going to have some good supports in place for all of our students. And I also want to say that I'm very sorry for the loss of your sister. I can't even begin to imagine how difficult that was.
And just last but not least, at the elementary school, I would share first and foremost, Maria, my thoughts and prayers are with you and your family. What a tremendous loss, and certainly during this very difficult time. Along with the other 3 principles, and as Dr. Hallett suggested, this has been a priority for us this year, and we intend to keep it a priority for the entire year. The social and emotional well-being of our students is critical. And in order for our kids to be able to rebound from this pandemic situation, we need to provide all kinds of strategies for them and safe places for them to talk and think and share. And so I think the only other thing that maybe wasn't mentioned is we have weekly SEL classes that happen in every single one of our classrooms. Along with our teachers keeping track of what they're noticing in this remote time period, they do that during the school year as well. And then we form lunch bunch groups, and we target kids for particular support. And this is always driven by what the teachers are seeing and hearing from the students, because those are the people that the kids communicate with the most. And then we provide any layer of additional support that includes not only guidance counseling or school counseling, but work with our social workers. And some of this, they will learn those strategies for the first time in their SEL classes. So I just wanted to make sure we shared that. And then we had a protocol that we began in March of last year, where we would do, as Mr. Horton suggested, we would be keeping lists of kids that we had concerns about. We would discuss them weekly in a student support team meeting, and guidance would do immediate follow-up each week.
Thank you. Mr. Sordovic.
I just wanted to add that the school committee recently adopted a new harassment policy that would apply to some of the concerns that were just expressed. And I have ultimate confidence, I was looking for the right word, that our staff and administration are alert to and will respond to any of the kinds of harassment that she's talking about. We know it's begun to exist, and it's our intention that it be stopped immediately. Thanks.
Thank you for mentioning that. Zona?
I just want to mention too, it's, and I'm sure somebody was going to say this, sensitivity training for the students or whomever is rendering the targeting. That's important too, because we have our students that need something extra, but we also need to help the ones that are creating the victims, if you will. So I just want to mention that. I know we've talked about that before, and I'm hoping that we bring some programs virtually, if it has to be that way for now, some sort of sensitivity training. Because if you never help a person that's doing the bullying, doing the targeting, you're never going to get rid of the problem. You're fighting against the tide. So I just want to mention that, Maria, so sorry for your loss. There is nothing like a sister. So sorry to hear that. Prayers for you and your family.
Thank you. Jen?
I'm sorry, there are a few more people that raised their hands, but we had already kind of cut that off. I will share some of the comments that came in. A couple just very briefly. Kim Latlip wanted to know if the younger kids could come back earlier. Kate Garrett said, could you consider bumping it back till Monday or a week? One of the important questions I thought you might want to address, Rocky Fox said, is there an exact number that we should be aware of that will put us into remote? And what would that be, and how does this get calculated? I think a lot of that was addressed, but it seemed like an important question. And then I have one more important question, if I may.
Yep. Do you want me to address, do we want to address particularly Rocky's question? I think the others we may have addressed a little bit.
Yes, please.
Okay. Roberto, help me with this. I believe it's the R number. Is that what's going to potentially push us to a real concern with regard or higher?
There is no one metric that's going to define closure or reopening.
Right.
So we have to look at the situation as a whole in in all of it here. We have to look at everything from symptomatic to asymptomatic spread. We have to look at the R number. We have to look at just our positivity rate, just our 7-day moving day average, things like that. There's a lot of different metrics that go into it. It's not going to be a decision that's been taken lightly, and it has to be, we have to have a line of experts really kind of showing that there is no other way, is really the most important part. And then I think with that is probably the most, that's in the R number on top of it. So I'll be keeping an eye on it every week, and you'll see my reports every Wednesday, and I'll be forwarding them to Dr. Hallett as well to get that to the school committee.
Thank you. Jen, you had the other question you wanted to share.
Yes. Allison H., she asks, how does the closure or opening of the schools for classes affect the October 3rd and October 10th administration of the SATs?
That's a good question. We'll have to do a little research.
Okay.
Oh, Zona? You're muted, Zona?
One of the hand raises, Fabrizia Machiavelli. She had her hand up and down. If that's a she, I apologize if it's not. I'd like to hear.
I can learn to understand you much better if I can get familiar with the way you talk. I need your permission to help. I can learn to understand you much better if I can get familiar with the way you talk.
Can you guys hear that?
Oh, yeah.
We understand you.
Sorry, did you hear what my request was?
Yes. Is Fabrizia is she available?
She's there. She's still in the participant log. If Jen could address her, maybe.
She doesn't have her hand up. If she would like to raise her hand, I can certainly allow her to speak. Fabrizia, are you there?
If I may, in the meantime, oh, I see her. There she is.
Oh,
is she
hi.
available?
Hi, can you hear me?
She's still in the participant.
Yes, we hear you.
If Jen could address her, maybe.
She doesn't have her hand up. Hear you. If she would like to raise her hand, I can certainly allow her to speak. Fabrizia, are you there?
Yes, I'm wondering if you can hear me.
If I may, in the meantime, oh, I see her. There she is.
Oh, hi. Hi, can you hear me?
She's still in the participant.
Yes, we hear you.
Somebody has YouTube on and they need to shut it off.
She doesn't have her hand. Hear you. If she would like to raise her hand, I can certainly allow her to speak.
Okay, hi. So
Fabrizia, are you there?
Yes, I'm wondering if you could hear me.
Fabrizia, you need to turn YouTube off.
Yes, we hear you.
Somebody has YouTube on and they need to shut it off.
Shut it off. Okay, now can you hear me?
Yes.
Hi. So, I mean, I just want to thank you, like everyone else, thank everyone for being here and providing an open forum for all our parents and all our educators. And I just wanted to voice a little bit of my concerns because I do see that we're in the red zone and I see that there's more cases every single day spiking up. And my suggestion and my input is that maybe instead of jumping the gun and going for a full closure or saying, let's all go to school on Thursday and Friday, that maybe we just all take a step back and do a delay and just see what happens with all these cases that are rising up every single day. There's more and more and more and more cases. And I see that the teachers are concerned, and I see that, you know, some parents want to go back, and many parents like myself are worried about sending their kids into a building full of children when I see that even the meeting to discuss sending the kids back is being held virtually. So that is worrisome to me. So I just wanted to come on here and put my 2 cents in and say that maybe we should consider a 2-week delay, continue being online for these 2 weeks and see what happens with these daily cases, which seem to be coming and coming and coming every day. I think that's it. Thank you.
Thank you. I do want to just mention, as we're kind of closing up, I know there are some folks who did not get their questions answered. Please, we would like to answer your questions. So if you could please send those certainly to me. I'm happy to share it with the appropriate people to answer, and we can make sure that your questions have been heard. Anything else, Jen? Okay, well, I think that this has been successful. I appreciate everyone's participation. I want to turn over the closing of the meeting to Pauline Proch. But again, thank you for all the panelists. Much appreciated for your time. It has been a long evening, but there's been a lot of great discussion that is helping me to think carefully about where we're going. And I just want to reiterate again, the children's education and safety, and the teachers and staff as well is my #1 priority. Whatever decision we go with, I'm sure there will be some who will not be pleased. But our job is to work together and move forward and figure out the best way we can to educate the children in this difficult time. So I thank you all for your participation, your comments, and I'm going to turn it over to Pauline.
Thank you, Beth. This is closing this public forum, and I would like to, on behalf of the school committee, thank the select board members who were in attendance, our Department of Health staff and committee, our town of Nantucket, Nantucket Cottage Hospital, our union reps, our school staff, our school committee, and particularly our parents and community members who asked questions and participated in the conversation tonight. This is one of the hardest decisions that will ever have to be made, and I appreciate everybody working together. And I thank Dr. Hallett for working so hard around the clock and continuing to get as much information as you can in order to make a qualified decision. So thank you, everybody. Good night, and thank you, Channel 18, for hosting.
Don't forget the Board of Health. Thank you, Malcolm.
I did say Board of Health. I said Department of Health, Staff and Committee. Yes, I did, sir.
Okay, ma'am.
All right. Good night, everybody. Thank you.